Hello, today we're going to be talking about our community agency, our final case study project. My name is Sarah Golshiri.
And I'm Rochelle Padre. What is our community agency? Our community agency is a community-based campaign that focuses on bringing awareness to eradicate human trafficking. It also brings awareness to victims who have been trafficked and how to help. This agency is a volunteer-based organization that provides resources for victims in the form of toiletries, backpacks, clothing, and toys, and is focused in the Tampa Bay area.
They also provide resources in the form of taking clients and moving them to other locations in the sense of referring them to other places. So if they need help in certain areas and they're unable to provide that service, they're able to send that client to another location to get the help that they're needed.
What is occupational therapy? Occupational therapy is a physical and psychosocially focused form of rehabilitation that seeks to aid those who have suffered from trauma, disability, or impairment. Our organization would benefit from having an OT because they would be able to take a holistic approach to aiding these victims. This means that they will be able to rehabilitate them physically, but also have a mental perspective and attempt to rehabilitate any psychosocial damage. Who is our client? Our client is a white young female who is 15 years old, and her background information includes that she was saved from a sex trafficking ring in the local Tampa Bay area. She was abducted at the age of 13 years old as she was walking home from school. Her diagnosis includes generalized anxiety, post-traumatic stress disorder, and depression, which all affect her everyday life.
So now we're going to take a look at theories and models. So as it stands, our current agency does not utilize an occupational therapist. However, if there were an occupational therapist, I do believe that they would use the model of human occupation. This is because it is a client-centered therapy. This means that the client and the therapist are both on the same level. They're able to work together as partners and not as one above the other. This is very important when taking into consideration someone who has been in any form of trafficking, because when you are trafficked, you lose control. You have no control over what you do, what anything happens in your life, and it's a very scary and traumatic time. And going into a client-centered therapy allows the client to regain control of their life, really pursue what they want to do to help better themselves, and it kind of serves as a motivator for them to get better. And as we mentioned before, this model and most of occupational therapy is very holistic. This holistic perspective, again, takes into the consideration the mind and the body. And you can see this demonstrated within our workshops, small groups, and social events as just some examples from this current agency. The workshops focus on time management. This is just an example because it shows that yes, there are people who are going through a physical disability and people who have a mental disability, but this shows how we're going to take a whole picture and bring it full circle. So we're trying to introduce time managing workshops so that people are able to get themselves back into a routine, get themselves back into any form of normalcy to really put themselves on the road to recovery. So how does this relate to our client? Well, it helps victims to understand their habits, roles, and routines. When you look at roles, it was who was this client? Were they a daughter? Were they a sister? Were they a peer? Were they a granddaughter? Everyone has roles in society, and it's important to take into consideration where they stand. And again, as we mentioned, routines. Routines are very important because it helps us really organize our time, really get back into our old lifestyle, and especially someone who's been taken away from that, it gives them control over their life to know what they can do on a day-to-day basis. Also, it's important for the therapist to look at the patient and client's habits because these habits can be negatively affecting them or also can be positively affecting them. So it's important to take those into consideration. Also, it provides a chance for them to regain control over their lives. This is very important, as I mentioned earlier, because a patient who has been in trafficking doesn't have control and they need that control again, and this helps them feel that they are important, that they are back on the track to recovery, and that they are no longer in need of being in fear. Also, when we look at the MOHO, we want to see what assessments are really important for this patient. And we felt the assessment of occupational functioning was very important because it assesses a client's view of his or her own strengths and weaknesses. This is important for the occupational therapist because it gives them a point to pinpoint, for example, the weaknesses. They'll figure out what they need to work on within rehabilitation. But the client is able to find their own strengths and see what they're still okay at, what they're able to do. And this is kind of serves as like a motivation for them. It also analyzes limitations in personal values, roles, causation, habits, and skills. This again is used to help the therapist find out what they can work on to help this patient grow. This assessment can be done in a self-report or an interview style, and it is followed by a rating scale. Client functioning on a 5-point scale to be exact, and the scale provides an overall view of strengths and weaknesses, as we mentioned before, how important those are. And this is going to be conducted by the therapist. They will be the one grading on the point scale. Also, this assessment yields information in regards to what factors affect occupational participation. We are able to see what can negatively impact the patient or actually positively, and we can take those positive occupational factors and motivate them so that the patient can continue on their progression. But also, if there's any factors that are limiting them or affecting them in a negative way, we can find out how to move on from them or how to confront them head on. So overall, we're looking at what a treatment plan would be for this specific client. So the client's problem is that the client is anxious about returning to school. Her depression causes her to feel unmotivated and discouraged about immersing into a hectic schedule. Her post-traumatic stress disorder causes her to have panic attacks and does not enjoy being in large crowds. Our goal is to get the client back to finish high school. This is because she was abducted at a young age and was unable to continue her education. The interventions and strategies we felt that were necessary for this specific client were weekly visits to a psychiatrist. One-on-one counseling would be good so that the patient or client is able to open up to the therapist and feel that confidentiality between them. But also group counseling would be a good choice because it allows them to see other clients or who are going through the same thing, and so they're able to gather either information or just coping mechanisms, how they're dealing it, how they can relate it to themselves, and also works on that social anxiety aspect because it allows them to work together. And anti-anxiety medication is given by a medical doctor. We understand that not everyone needs anti-anxiety medication, but it is something that the patient could look into. Time management workshops are very important because the patient wants to get back to a hectic lifestyle. Going to school is not easy. Juggling school with a normal life routine can sometimes be a little overwhelming, which is why the time management workshops are beneficial because it allows them to go back, and especially with our agency who already has workshops, go and participate with other people who are feeling and dealing with the same everyday life activities and kind of build a time management program that best fits them. Also, a occupational therapist could be utilized here, definitely in the emotional regulation area, because the occupational therapist can work with the patient on how to, in a more positive and beneficial way, an effective way, to control any unneeded feelings they're having, any sense of anxiety, any upsetting feelings, or any maybe feeling of anger that they could have from their situation.
Occupational services. We wanted to address occupational services with 3 main questions. The first question is, why do we need occupational therapists? They can help the client on everyday occupations, provide guidance in workshops, and practice activities of daily living. They also help set a normal routine. The second question is, how does this tie into the values? The agency focuses on support for the Tampa Bay area in regards to human trafficking. Community and faith-integrated actions are essential to their mission within the population. Within the fight against human trafficking, the national symbol is the Blue Heart. The Blue Heart is a United Nations symbol representing the sadness of those who are trafficked while reminding us of the cold-heartedness of those who buy and sell fellow human beings. And OT's mission aligns with our community agency's mission in the sense that they both want to foster community and help people both physically and mentally.
And to continue on to occupational services, how would the occupational therapist help the organization to meet their outcome goals? We figure that the occupational therapist will help clients get back to their daily lives. As we mentioned before, routines are very important. Finding coping mechanisms to overcome their traumatic experiences. Trafficking comes in the form of both sexual and hard labor. It is something that happens physically and mentally. So these experiences have a multitude of damage. So it's important to find coping mechanisms for all different aspects. Volunteers and organizations seek to stop the issue at the root of the problem, and the occupational therapists work on aftercare. We wanted to show that occupational therapist essentially brings the service full circle. Volunteers and the organization seeks out to fight the problem at the root of the cause, saving these people, getting them help, but then the occupational therapist steps in to really rehabilitate those needed areas and kind of tie up any loose ends and give them resources that they can use for the rest of their lives. Also, it serves as a rehabilitation point for client and family members involved. When someone is human trafficked at a young age, they're not only affected, but their family and caregivers are affected. So it is a great chance for the family and caregivers to sit down with the client and really find a way for them to get back together, reunite, pick up those broken pieces, and get back to their everyday lives. And that completes our slideshow for today, and thank you for joining us.